Really happy to be up here with Amy and Keala. So I'm going to speak a little bit about what we did in the immediate response. Amy will speak to where we are today, and Keala will discuss the lessons learned and the path forward. And I just want to say that public health nursing is one program within the Department of Health. There were many other programs, such as environmental health, that were doing work around things like clean air and clean water, but I'm just mainly going to be speaking to the public health nurses and the behavioral health division's response. Okay, so the Lahaina Comprehensive Health Center, thank you, Noi, for putting that picture. Lahaina Health Center is a state facility. It's just outside the burn zone. It was underutilized for many years, but it was still standing. So we did a site visit on August 12th. There was no electricity or phone or internet, but it was functional, so we decided to clean up and open it. Eventually, we would get a generator and a Starlink. It's an open building, as you can see, so there were concerns about air quality, and of course, the fires were still burning at that time, so staff safety was a priority. But we were able to open on Monday, August 14th. And really, we were able to do this with our community partners. So MauiWES Pharmacy, you guys keep hearing that name, that is a locally owned independent pharmacy. Malama Health Center is our federally qualified health center, and Hui no Ke Ola Pono is our Native Hawaiian Health Center. So these organizations, we had prior partnerships with them from the COVID pandemic response, from doing community outreach events. So we were familiar with them. We already had a working relationship. And I really believe it's because we had that trust with them that we were able to operationalize so quickly. So they helped clean the building. They helped purchase equipment that we needed, such as printers, computers. They were able to get things faster than me trying to go through the state procurement process. They really helped with staffing. Malami Keola was able to tap into other federally qualified health centers, and we had staff coming from Waianae Comprehensive Coast Health Center on the island of Oahu and Hawaii Island Community Health Center. Of course, we had other volunteers and help, Medical Reserve Corps, other local businesses like Maui Optics, clinical labs, insurance plans, vision service plans. Anybody that knows me knows how much I love our Hawaii National Guard medics. They were a tremendous help, but with everyone's help, and especially our core partners, we were able to provide mobile outreach and behavioral and clinical services. So just speaking about mobile outreach first, a lot of people, many families whose homes did not burn chose to remain in their house, even if they didn't have power or running water or communications. So the mobile outreach teams are really critical in assessing their needs and communicating updated information. So every morning the team would be put together and they would be assigned a different area to cover. Depending on staffing, the teams were as interdisciplinary as possible, made up of doctors, nurse practitioners, the nurses, case managers, social workers, and behavioral health specialists. And they would go door to door to share information. Oh, it's my boss. Oh, he can't hear. Sorry, am I not? I'm sorry, okay. I thought I have a loud voice all the time. People think I'm always yelling at them, so I didn't want to like yell into the mic. Okay, sorry. So services during mobile outreach. Most important, I think, was communication, really is what they were doing. But they were able to do assessments, provide care. They would refer people to the health center if there was more services needed. They would do medication reviews because we had access to the pharmacy. There would, emergency prescription refills could be filled. A lot of wound care at that time. A lot of health education. When the information did come out about the toxins in the ash, they went door to door and gave out information on how to be safe. Letting people know about where the food distribution hubs were and where people could go to get services. A lot of times it was just emotional support. People just wanted to talk about what they had experienced and what they had gone through. Sometimes the mobile teams were the first people to reach them in their homes if they had chose to remain in their home. The other outside agencies and programs, when they heard about that, also used our program to check on their own clients or to help find some of their missing clients. They were also used to move people away. You know, they chose to stay in their home, but it was still unsafe, so we helped them move to a hotel shelter. So just some pictures. This is how we kept track of the daily teams every day for safety and to ensure that all areas were being covered. So thank you to Pacific Disaster Center. I don't know if he's here today. Great presentation yesterday. I didn't know where those maps came from. They showed up in our health center, but they were super instrumental. We used it every morning um, just to map out who was going to go where, and you could see where their structure's still standing. So it was so helpful. I don't see him here today, but it was great yesterday to be like, hey, we really made use of that. So just more slides, more pictures. You know, in this day and age that we're so dependent on our smartphones and social media in communications, but really it was back to basics immediately after the fire. It was the mobile teams going door to door. You can see from the signs, like handwritten signs, communicating with each other what was happening. So back to the Lahaina Health Center. So as the mobile teams really got out and told people about our services, eventually more people came to the health center. So we're trained in incident management. We learned what was used during the COVID pandemic response to plan and operationalize all of the services. Every morning, this is our staff briefing. We would give the safety message, clarify assignments, and provide any updates since things were constantly changing. So the theme every morning was organized chaos. The staff was made up of multiple agencies. So we had to create our own clinic system of intake, documentation, consent forms, medical records. But we became a true comprehensive health center with a variety of services. So, of course, the medical and behavioral health side, we had insurance case managers from all the different insurance plans, social services. We had our pharmacy on site. We eventually added a lab. We offered free vaccinations. We had specialty services. Our dental was the most busy days. We had vision, podiatry, physical therapy, OB, pediatric services. We also organically started our own little mini distribution hub where people would come and drop off things, diapers, formula, hygiene kits, and then other people could just come and take what they needed. But we really serviced anyone that walked in the door, no questions asked, no insurance asked. We actually serviced a lot of people that were response workers and volunteers from other states, from other agencies who were on Maui helping with the response, actually came to our clinic for care also. So aside from the services, it really just became a communication hub. We utilized whatever we could find in this older building, and it turns out that old whiteboards were really one of the most valuable tools. We used it to keep track of our mobile outreach teams and also to list our services. So we would list when certain services were offered so that people knew what day they were there. So I would see people walk in, take pictures of our calendar to share out with their family or friends. Every day would get visitors, including politicians, federal agencies, and all the alphabets you can think of, dignitaries, media, but my favorite were the support animals. So during this super emotional, stressful time, we did also make staff self-care our priority. And we loved when the dogs came to visit us. So just some more pictures of utilizing the courtyard for group therapy sessions. We had to have a logistics room because we had a lot of donated medical supplies. The bottom picture is our podiatrist, who is actually a private provider who just couldn't access his clinic because he was near the burn zone. So he came and donated his staffing, his resources, and would see clients there. The middle pictures are dental. Again, there were always lines on the day of dental services, and we had to actually cap it and turn some people away. Our National Guard medics that helped us, some of them come with their own specialties in their daily work. So that's an example of physical therapy that would provide services when able. So we really tried to provide what the community needed. We had actually run out of space, but people kept asking for lab. The physicians were asking because they wanted, PT INR levels or cancer treatments that they needed their baseline labs. So we actually converted a bathroom to a lab, and we had to set up the chair draw station in the breezeway. But similar to dental, lab was one of our most popular services. People would be lining up before we even opened so they could get their fasting labs done. So you guys all know that once the congregate shelters closed, people were moved to the hotel shelters. So although Red Cross was present, there was a need for more health services. So one hotel, the Outrigger Kaanapali Beach Resort, who we also had a prior relationship with due to the COVID pandemic, they were our isolation site, but they offered us a clinic room. So we set up a clinic there, and that room was an extension of the Lahaina Comprehensive Health Center where anybody could walk in and get services. The picture on the right is our hotel engagement carts. So these were donated airline carts that the behavioral health staff would use to go door to door in the hotel rooms, knock on their doors, try to check on people, give them information, offer healthy snacks, but really just get them to come out of the room so they could check on them. Happy Noi covered the reentry support. So by October 15th, the pre-existing medical clinics had all found space to reopen on the west side. So we were able to close down the medical services at the clinic. Of course, the behavioral health services still continued, but public health nurses were able to shift our focus, and we joined the Maui medics and Healthy Mothers, Healthy Babies, who had already been doing the reentry support since September 25th is when reentry started. So it was really important for affected individuals to visit their burned property and sift through the debris for their personal belongings. So, no, we covered it. I'm just gonna move on. So, affected people we all know are no longer in the hotels, and they're now in transitional housing all around the island. And we know there are people who may fall through the cracks. So we continue to work with our partners, participate in various community events to reach those that may need support and services, like Maui Wildfire Exposure Study recruitment events, just to get out as much as we can into the community. So in the response, we learned the true power of community, and we saw a true system of reciprocity. It really was an honor to be part of a community-driven, collaborative, and really holistic healthcare system, and I hope that we can continue it even post the disaster. So it was really interesting to hear yesterday about the World Trade Center Health Program and Registry, and I hope that there's something like that that can be stood up on Maui eventually. But Amy will now speak more about services being provided as we continue to build community resilience.
Okay, thank you. Dr. Pang, can you hear me? Okay, good morning. I'm Amy Petersen, and I'm also with the Department of Health. I am not a nurse. My background is in human resources, and my path to Lahaina was a little bit different. My connection to Lahaina is I worked in one of these amazing hotels that I'm very proud of my 21 years of employment. Also have learned of some of my ignorance as I went through that 21 years and built incredible relationships. I feel like I can hold two things at the same time. I know I've learned a lot in the last 15 months about Hawaii and about Maui and about Lahaina specifically, and how I can hold both at the same time. I've learned so much more in the last 15 months than I have in my 29 years here on the island. So, and that is to people like Noi, who is willing to educate and support and love and care for. And so that has been an incredible journey. But my relationships with people in Lahaina and my family in Lahaina who lost is what brought me back to Lahaina. I was on the south side for the last 7 years. And I wasn't here immediately after the fire. I intuitively knew I needed to be invited into the space in order to serve in any way I could. So I volunteered with Maui Rapid Response, who Noe talked about earlier, and they set up an incredible disaster recovery space, more culturally appropriate, at the Maui Nui Botanical Gardens. And I think the biggest learning for me personally was it was not about any skills that I had or resources or who I was or who I knew. In that space, it was all about being, shutting up, really listening with my heart, holding people's pain as well as I possibly could, and just allowing people, Heidi had mentioned, just to share their stories. And a lot of people I knew and a lot of people I did not know, but those people that I connected with at the Maui Nui Botanical Gardens, to see them today, that connection will never go away. And it is pretty incredible to, in this disaster space, it's just being present and really seeing and hearing people's stories is going to help with the collective healing that is happening. And I think you spoke yesterday about mental health, and we know the further away that we get from the August 8th, 2023, that the mental health needs will increase. I'll talk a little bit about what's happening today, so thank you for allowing me to share a little bit. So the programming and service, I'm part of the SURGE grant, which is the SAMHSA Emergency Response Grant. So it is a 2-year grant, and DOH got the grant, and then Papaololokahi, who is the Native Hawaiian Health System, they are the fiscal agent for the grant, and they work with different vendors and providers to do all the contracting. So the grant was given in October 2023. By the time the providers, all the contracts were done and funds were available to provide services, it was really not until January, February that a lot of the services got off the ground and started providing different services. So the grant covers behavioral health and promotes healing and in every sort of modality that I think you talked a little bit about yesterday. So right now we have partnered with several organizations who are currently offering services at the Lahaina Comprehensive Health Center. I'm very proud of my relationship with Noi, and volunteering in reentry and learning from Noi I feel like that relationship has been incredible, and her team has been servicing Lahaina residents since the fire. And once Malama Ikiola moved out of the Lahaina Comprehensive Space, we were able to clean it. And it did take a little bit of time because we are a governmental agency, but we were able to get it cleaned up and have Noi moved in July. And then we share the space with the Community Certified Behavioral Health Clinic, and they have case managers, psychiatry, psychotherapy, and different therapy modalities that have been servicing Lahaina since August. And in the middle there, you'll see Lahaina Health Center. We have several programs there now. We have Kanakapila Project is on Mondays, and at 12 noon, we started with one person coming to ukulele, and now they are up to 13. So it took about 3 or 4 or 5 weeks to get that number, but people drive from Kahului, Lahaina residents drive from Kahului to be in this space and to enjoy each other. The 2 women that were sitting in the space that Noe showed a picture of, they come every Monday and they spend about 5 hours at the clinic between talking story, having services at Maui Medics, and playing ukulele, and also they do a Tao healing class. So it's been it's a safe space. It's only Lahaina residents are there, and people get all different kinds of services. So the SURGE grant has 25 providers for year 2, but we have created that Lahaina Health Center is for any organization that is providing services for the community. Here is a survey that was done in July of 2024, and this was asking the community what programming they would like to see moving forward. So we are working on more of a still temporary, permanent, I guess, resiliency center, which is in Kaanapali called Ke'olaho, so that this survey was distributed to talk a little bit about Ke'olaho. And then these are the programs. Obviously, our programs are going to be based on what the community wants to see. And here is just an example of some of the SURGE providers that are currently working out of the Lahaina Health Center. And then and some of our other partners that are doing all sorts of amazing events in the community to support and promote healing and well-being. So I know we're out of time, so I'm going to go ahead and let Keala talk about the framework and moving forward.
Thanks, Amy, and sorry if I zoom through this. I think we only have a few minutes, but my name is Keala Kaopuiki-Santos. I am a project manager for the Office of Wellness and Resilience. Our office was started in January of 2023, and mostly with the focus of providing trauma-informed care training to state offices and improving overall wellness in state offices. I started in May here and was the only staff person here on Maui and then we were in the middle of strategic planning when the fires hit. So much of my focus shifted towards collaborating with these amazing women and many others in coordinating volunteer mental health providers and wellness activities in response to the fire. So in the months following the fire, we realized the need to document what had occurred as part of the disaster response efforts and identify what worked and what didn't. So in March, 6 months later, in March 2023, we invited partners representing government agencies, nonprofits, philanthropic groups, and private practice to participate in a convening to document what had occurred and gain a better understanding of what was working and identify the needs and gaps for survivors. Over 80 individuals attended, representing over 40 organizations. And so while the data, you can see some, we kind of went down a timeline documenting all that had happened, identifying who was doing what and what needs still existed. So the data gathered was overwhelming, but many of the takeaways and recommendations were really quite simple. So I'm going to go through a few of those pieces and then show you the beginnings of a framework, both a preparedness framework and a response framework. So the first piece that we highlighted was the need to convene, communicate, and collaborate. It's important to know the existing resources in your community and who you can rely on ahead of time. The day following the fire, our office was tasked with deploying volunteer mental health providers to the congregate shelters. With no roadmap to follow, we sent out a Zoom invitation to a few of our colleagues. By the 12 p.m. call, over 250 people had joined the Zoom. We continued to hold daily check-ins for the next few months and then eventually moved to weekly check-ins. These calls continue and have been a crucial way of sharing information between providers and continuing to identify needs and barriers on the ground. And additionally, as Heidi shared, collaboration was the key in the success of the Lahaina Comprehensive Health Center. Services and staff were provided through a partnership of government organizations, large corporations like Kaiser and Queens, individual private providers, and nonprofits. They provided health services under one banner, Kokua Lahaina Rising, with no budget or board, but also no bureaucracy. They were entities with the same mission, to help the community. While there's a budget now, the Lahaina Behavioral Health Center continues to host organizations outside of the Department of Health, like Amy shared, that provide services free of charge. But really, the collaboration and the communication that occurred and continues to occur to this day is so key in response. Our initial response, in the immediate days following the fire, we had an influx of volunteers, like I shared. Since there was little time for vetting, we initially asked for 3 requirements for those deploying to the shelter and out into the community. That they were licensed, that they only provided for us, it was the mental health response, psychological first aid, as you can see the steps outlined here, and that they were from or had a connection to Maui. And our reason for that was that this is what much of the response looked like. Maui was immediately inundated with response teams from all over the country, including those from FEMA, Red Cross, National Guard, and U.S. Public Health Service. While well-intentioned and necessary, cultural differences were apparent from the get-go, and many survivors, especially those that were undocumented, were fearful and wary to engage with those in uniform. So, one of our recommendations is that we deploy local providers, trained providers to go out alongside these national responders. relationship is huge in Hawaii, and huge as far as trust and comfort goes. Our next recommendation is to ensure that there's awareness of the racial demographics and languages spoken in the area. As you can see, Maui's demographics vary greatly from the overall US population, with over half of Maui's population identifying it as Asian, Native Hawaiian, Pacific Islander, or mixed race. And as Roots Reborn shared yesterday, you know, there is also a large Hispanic population on this side. Unfortunately, I think this is probably the best data that we have, but it's the US Census Bureau, so it doesn't capture, it doesn't capture everyone that's here. But you can notice the vast difference. Okay, and then our next piece is the importance of educating on cultural and historical trauma. And so Noi spoke to that this morning, I think this is key in any area that you're responding to a disaster, and it's important to know the indigenous culture there and the cultural trauma that has occurred. And so for Native Hawaiians, there's a huge amount of historical, cultural, and generational trauma with the loss of kingdom, land, language, and identity. The pain of this loss has carried for generations, and the Lahaina fire has reopened many wounds around land ownership, water rights, and distrust of haole, or those foreign to Hawaii. It's crucial for those being deployed here to have a basic understanding of the culture and history so that they cause no further harm. And then our next recommendation is to offer comprehensive and holistic services, cultural ways of healing, and opportunities for community to gather. These are pretty self-explanatory, but oftentimes we think of wellness. When we think of wellness, we think of these activities: massage, acupuncture, as Noi shared, yoga, dance, music, arts and crafts, planting. Many folks still, to this day, still say they're not ready for traditional talk therapy, but they are ready for this, and they express that they feel better as a result. And sometimes this opens the door to being willing to talk. And just, like I said, relationship builds trust, and seeing the same person over and over again, you're more likely to open up and share. And there's healing in connection with each other and connection to the land. So that is a key piece in our recovery. And then this is part of disaster preparedness and response, identifying trusted partners and available funding streams. These are just some of the amazing partners that stepped in and provided either funds or manpower in these efforts. And we have we have Maui Arts and Cultural Center here today, of course, Maui Medics, and so many others. Okay, and so, like I shared, the next two slides are the beginning of disaster preparedness and disaster response frameworks. Please know that these are drafts that we are continually updating. After listening to the presentations yesterday, I was like, I need to add more and more to this. But our hope is that these frameworks can eventually be used to inform health and wellness, disaster preparedness and response, not only in Hawaii, but in communities experiencing disaster throughout the world. So these might be a little hard to see, but training and practicing on a regular basis, convening these groups and being prepared, educating, like I said, on historical and cultural trauma, racial demographics, languages spoken, making sure that we have those folks that represent the different racial groups that I shared and speak those languages so that they're ready to go. Identifying trusted partners and available funding streams. And I added this one yesterday as I was driving back. So my husband is a first responder and actively responded to this fire. And so one of our biggest struggles has been getting them involved in health and wellness activities and services, making sure that those are available. And while they're available, there's still a stigma around it, and many first responders don't engage. So I think a part of preparedness is normalizing wellness programs before a disaster. Make it a regular thing that there are debriefs on a weekly basis, that there's group so that it just becomes regular that if they're responding to a disaster, they walk into these weekly wellness activities because it's really hard to get them after the fact. And then health and this would be the actual in the midst of a disaster. So there's a preparedness piece, and then in the midst, right? We're providing for basic needs. That's the first step. Like I shared, that psychological first aid, Maslow's hierarchy of needs, trauma-informed care, just providing that support and immediate medical attention. The need to convene, communicate, and collaborate, the mobile outreach that Heidi shared, and deploying local providers alongside and resource navigators alongside those national organizations. Establishing a central hub, a safe and easily accessible place for folks to access services. Again, so you have your team that you've prepared ahead of time, but for those groups coming in, FEMA, Red Cross, even if it's a 1-hour training, right? We need to educate on the racial demographics, cultural competencies, and historical trauma. Offering these comprehensive and holistic ways of healing and opportunities for community to gather. Providing heal the healer opportunities. We need to remember ourselves in this, and it's hard to do that, right? But really being very mindful about creating that time for your healers also to decompress and to get the support they need. And then I added this piece yesterday. This has been a very difficult piece. So creating a survivor registry. So I know you folks are, have that with the wildfire exposure study. Many of you shared your registries, but I'm talking, I think that is very key, but if there are ways that we can expand it and really outreach to as many survivors as possible, the need to disseminate information and gather data is huge, but knowing when a survivor has moved, I mean, we've heard 17 times, like 17 times over the past year and a half. Knowing where someone is to be able to provide those crucial services, or at least offer it to them, is such a need, and we're still not there. We can reach through different registries, through different programs, maybe a couple thousand, but when we're talking over 10,000 survivors, we need to know where these folks are, and we need to be able to get information out quickly. So as far as next steps, we formalize and implement these health and wellness disaster response frameworks. We identify what resources we have in our community. We train health and wellness providers, and we deputize. So this was one of the challenges when the Red Cross shelters set up. Many people were turned away when they and these are licensed mental health providers, were turned away and not allowed into the space. And so when we say deputize, it's just more so because right now we fall under the office of the governor, ensuring that those that are in these coordinated preparedness efforts have the authority to go in if a disaster occurs, and that they can get in the day of. And that's all. Thank you so much.